Joining me now, Admiral Brett Giroir, Assistant Secretary for Health at the Department of Health and Human Services and Testing Coordinator for the White House Coronavirus Task Force. Admiral, thank you very much. You just heard Dr. Fauci expressing regret for not pushing harder for more testing earlier. You've been touting the number of tests the country has done, but how do you respond to those regrets from Dr. Fauci?
Well, thank you for having me on, and I hope we get back to the first 2 points that you made, which are really the most critical.
Absolutely.
We have surged as many tests as we could possibly do. Since I took over on March 12th, we have put every effort. We've used the DPA. We have over 3,000 retail sites, over 10,000 federally qualified health centers. We've distributed 162 million swabs. We've done 168 million tests. We are now distributing these Binax cards, over 54 million of them just in the last few weeks. So whether Dr. Fauci would have pushed more or less, he's never been faint of heart to tell what he really feels. We have done the maximum that we could do, invested everything we can do, and I can tell you from March 12th on, there is not a stone unturned that we didn't do to provide more testing, and we're continuing to do that on a daily basis.
Well, let me talk about the lines at testing sites. And we've seen in San Francisco, we have a correspondent who's been reporting there. The lines are just extraordinary. People seem to be trying to get tested. Partly it could be college kids wanting to go home and others wanting to travel on Thanksgiving and having the false assurance of a test, that if you take a test that you can then immediately get on a plane and you're safe and you can visit with, your elderly grandparents. Let us have a reality check from you. I think it would be very helpful right now. That testing is not a cure-all for people who want to travel and have Thanksgiving.
Yeah, thank you so much for pointing that out. We absolutely want people who are symptomatic to be tested, people who have been close contact with anyone who's positive to be tested. In many areas, we are routinely testing all college students within universities because they can be a source of community spread. But that negative test today does not mean you're going to be negative tomorrow or the next day, and certainly not by Thanksgiving. And it is not a free pass to go without all the important measures that we want, particularly mask wearing, physical distancing, and following all the recommendations that the CDC has for the holidays. If you Google CDC holiday gatherings, there are a number of really good graphics to help people understand how to be safer over Thanksgiving if they choose to have family gatherings. But you're so right, Andrea. All tests are imperfect, but even assume they're right. A negative test today doesn't mean you're going to be negative tomorrow or the next day or the following, and it's not a free pass. So if you're in a group that should be tested, please be tested. If you're just doing it to say, I'm okay to go for Thanksgiving, it doesn't give you that assurance. You still need to do everything we've been talking about: masking, physical distancing, washing your hands, avoiding crowds.
And while we're talking about testing, I want to ask you about the FDA emergency authorization of a new at-home rapid test. That would seem to be a very positive sign. When could that begin distribution, do you think? How quickly?
Yeah, it's very positive, but it's still a very limited capacity. It's a prescription test. It's not over the counter. It's only authorized for those who are symptomatic, and there'll only be 50 or 100,000 a month of those available shortly, and they're relatively going to be at high cost. So this is an important advance. I don't want to minimize it. It's the first step to home testing, but it's not going to make a big dent in what we're doing, like right now, distributing 35, 40, 50 million Binax cards per month to our vulnerable and to our states. But it is an important step. And I do want to get back to the vaccines and where we are in the outbreak. If
Sure.
You're going to go there, I'd love to do that.
No, let's talk about that. But I do want to ask you about the White House memo. But let's talk about the vaccines.
Yes.
It's obviously very positive news from Pfizer, and we also have the Moderna positive news as well on their stage 3 trial.
Yes, this is very positive news. Both companies reporting in the mid-90s of efficacy, which is tremendous. No safety issues that were identified. And very importantly, it's sort of in the second paragraph, but to me as an intensive care physician, should be in the very top. is it prevents severe illnesses, and it also works in the elderly. Pfizer showed that it works in the elderly. Moderna has not reported that from their current trial, but they had a New England Journal of Medicine article earlier that shows that it works in the elderly. So this is fantastic. We have a highly efficacious vaccine, probably 2 of them, maybe more coming, with a very clean safety profile that prevents serious illnesses and that work in the elderly. So we can target these vaccines very early to those who are most vulnerable, the elderly, those with other comorbidities. So this is extraordinarily positive. What is not so positive, though, is that we have to understand where we are right now, and that gets back to the White House memo. The vaccine will be the end game to the pandemic. We will have 50 million doses of Pfizer and an undisclosed amount, but many, many millions of doses of Moderna this year. But right now, we are in the steepest rate of rise in numbers of cases. Our hospitalizations are going up 25% week over week. Our deaths are going up by 25% week over week. And this is not going in the right direction. We are at a absolutely critical, dangerous point, and I want to urge everyone that the only way that we get out of this until we have a vaccine is to absolutely wear a mask when you're in public. We know that local or state mask mandates tend to work, and many places have instituted that. In most places, we're going to have to limit indoor dining and indoor bars. That doesn't mean takeout needs to be limited. Many people want their Thanksgiving dinner by takeout. That's fantastic. We're going to have to limit those kinds of things like they're doing in Europe. Now, even in Europe, they're keeping K through 12 open. And in France and in the United Kingdom, they flatten the curve. We can do that here. We did it in Arizona, Texas, Florida, across the Sun Belt, across the Deep South. But right now, we are in a absolutely dangerous situation that we have to take with the utmost seriousness. This is not crying wolf. This is the worst rate of rise in cases that we've seen in the pandemic in the United States. And right now, there's no sign of flattening. We all have to be incredibly concerned. We all have to be diligent. We all have to make clear choices to wear our masks, to physically distance, and try to make a better choice every single day about where you're going to gather, how you're going to gather, and how you're going to protect the vulnerable.
Well, I really appreciate, I know our viewers do, your honesty and your direct messaging here. If it is this critical, which it certainly seems to be by all the metrics, why not share this information in real time with the incoming Joe Biden team so that there can be a seamless delivery of vaccines and there can be seamless messaging from the current administration to the next?
So I want to I'm going to answer what you're implying first is, look, the GSA controls when transition occurs. And as soon as that's turned on, we're going to do this professionally, transparently. Many people on the Biden team.
I know you will, but
we are public health people.
Shouldn't there be pressure from, but this is a public health emergency. This GSA official is violating the law because the law says the apparent winner, not the certified winner, not the Electoral College designee, the apparent winner. I know it's not up to you, but is there anything you can do with your influence and others within the administration to try to get past this political deadlock in the interests of public health?
So I want to tell you that my role is to transmit the information as clearly as possible, and I'm going to be as transparent with anyone in the Biden administration or in their task force as I am with you. We all know what the data show. The data are absolutely concerning. I lose sleep at night over where we are in the pandemic right now. But we all also know how to beat this, right? There's a playbook that we've done here. The public health professionals on the Biden team know that playbook. It's being done in the UK and France to flatten their curves, and we absolutely have to do it now. We are all going to be on the same page in the public health measures because there's a clear playbook. And again, we don't have to do this for 6 months, 9 months, a year. The vaccines are around the corner. But if we don't institute these measures and be very rigorous at the state and local levels about limiting certain businesses, not all businesses, most businesses can stay open, K through 12 can stay open, but we have to have masks, we have to limit indoor crowded spaces. If we do not do that, we will lose tens of thousands of Americans by the time the vaccine is out and widely distributed. So I am urging everyone, and you will hear every doc on the task force saying the same thing, that this is really crunch time. This is not crying wolf. this is a time that we need to really double down because we are at the most serious and dangerous part of the pandemic that we have been in the United States until this time.
Well, I appreciate what you're saying. We have to hear it from the Vice President and from the President of the United States, because there are some 73 million Americans who will not listen to you or to me or anyone else unless they hear it from the man on Twitter. Thank you very much, Admiral. Thanks for coming on. I appreciate it.
Thank you, ma'am.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.